a lot of the risk indices are, I think, a great tool for us to actually start utilizing in order to understand the potential community or environment that our patients may be coming from. And so the area deprivation index score, the social deprivation index score, the social vulnerability index score, which I'll be very honest, that's my favorite one, just because it's been so highly validated and used by the CDC. And then, as you mentioned, the local social inequity scores. And then there's others that several states have as well. And so I think these are excellent proxies at a community level. So if you have an individual, let's say I walk into my physician's office and they don't know anything about me, but they can actually pull out my zip code and they can run it on the census tract and say, okay, Medell lives in this area. We know that this is already present in our area. This is the composition of our area. So if we are going to recommend certain medications or certain social services or whatever that may be, we know what's around her. So while it's not a one-for-one match, I do think it's a wonderful tool for us to use these indices to say, is someone living in a community that's more vulnerable, that is under-resourced? And if so, what that means is that we're going to have to increase our support or increase our services for them. Because if someone's living, let's say, in a highly socially vulnerable community, and I say, here's a prescription, I want you to go to your local pharmacy and fill this prescription, but we know that they live in an area in which there's not many pharmacies. Before that person leaves my emergency department or leaves the hospital, we're going to bring the medications to them, or we're going to arrange a mail order system for them to ensure that they don't have any barriers of getting this very important medication.